Hi, everyone. My name is Nikki, and I'm a healthcare performance consultant in Baltimore, Maryland. And today I want to talk to you about nurse turnover. Yes, I know the stats, but have you heard the most recent? According to the November 2021 Hospital IQ survey, 90% of nurses are considering leaving the nursing profession in the next year, with 71% of nurses that have over 15 years of experience thinking about leaving as soon as possible or within the next few months. Let's pause and consider what in the world it would look like when 90% of our nurses walk out of every hospital, outpatient care clinic, community-based organization, health department, state department. And not only that, the most experienced nurses who guide and model our professional standards won't be there to teach and role model. It leaves a burden so massive and so vast on our hospitals and our health systems, forcing nursing schools to find and fill these gaps as quickly as possible, forcing longer waiting times in patients, and almost backbreaking mental, physical, and emotional strain on our most valuable resource, our nurses. And if we needed worse, as of the beginning of this month, COVID has killed more than 1 million people, and it has dealt a crushing blow to the already weakened morale of our nurses. It has brought to the immediate surface that the compassion towards our nurse workforce is woefully inadequate. I'm talking about what we already know, toxic culture. Studies estimate that 44 to 85% of nurses are victims of workplace bullying behavior. Up to 93% of nurses report witnessing workplace bullying in their own workplace. And did you know that in a survey of more than 5,600 nurses, that 94% of them say they know that there is either a lot or some racism in their profession? Having had firsthand experience with racism in nursing, I have worked adamantly for the past 5 years to educate my colleagues about the dangers of this particular violence. I mean, it's so damaging that it causes actual biophysical changes in your body. And I focus my efforts almost exclusively on diversity, equity, and inclusion, knowing that the terrible disparities that exist in healthcare for people of color and marginalized communities has got to end. I've done workshops, I've spoken to corporate healthcare giants and small businesses alike, but I often walk away almost cringing afterward, knowing that without a more effective strategy than creating a racial justice statement or offering a single implicit bias training, it won't bring the overhaul to address nurse turnover. What healthcare leaders need is someone for us, like us, to teach how to cultivate our people. They need performance management, and that's where I step in. As a healthcare performance consultant, I help you find the tipping point before healthcare professionals leave in droves due to burnout, toxic stress, and secondary stress. And I help you put in place a coaching culture that promotes transparency, respect, and trust. Most leaders don't know a thing about preventing nurse turnover through a coaching culture, but I do. As a nurse and coach for almost 20 years and a supervisor, a clinical leader, I've worked in many settings, managing cardiac crises in one of the top hospitals in the country, directing nursing programs in Trinidad and Tobago, triaging care as a nurse care coordinator, and in none of these varied settings have I seen a coaching culture implemented. When I did my coach training almost 20 years ago, I learned that coaching is so impactful and that we have been missing in healthcare a coaching culture. A coaching culture is a strategic approach where leaders and managers and valued employees use coaching technique to motivate people to accelerate their growth, to result in engaged and expansive workforce of high performers. And the top reasons nurses cite turnover are due to feeling unfulfilled and lacking role clarity, having a low sense of control over their job performance, poor communication with management around critical issues, not receiving recognition for work done, and most importantly, a lack of trust. What coaching culture does is shift toxicity by focusing on what matters here and now and opens up lines of communication and collaboration. There's a huge difference between giving instructions and telling nurses to follow them versus coaching them to learn. In coaching culture, the individual takes ownership for their work, speaks up when there are critical issues, even with their own performance, and is not afraid to call out or call in for support. In other words, cultivating a coaching culture supersedes nurse turnover by helping your people to develop their own leadership qualities. If you want to learn more about this topic, check out my social media. Thanks for listening.